I'm Dominic Whitehouse. I'm a consultant and working in palliative medicine in our local hospice. What would worry me about assisted suicide being legalised is the effect it will have on, well, three main areas: the medical profession, the effect on the patients themselves, and also on wider society. I was at the BMA conference in Northern Ireland recently. There was a fringe meeting and there was a Canadian palliative care doctor talking there about the impact of the introduction of assisted suicide-euthanasia there, where doctors are being discriminated against, in danger of losing their jobs if they won't refer people. Even if they're not happy to do it themselves, they're still supposed to refer people on for this. It was only introduced 3 years ago, but there's already a very slippery slope pushing doctors towards considering it in all their severely ill patients. I do think there is a real risk that conscientious objection will be compromised. I'm sure that in the UK initially we'll write some safeguards into law, but the euthanasia lobby is strong and it's persistent, and I think the goalposts will be moved forward. One of the problems about assisted suicide is the message it gives to your patients. So it may make them feel less valued as members of society, more disposable if you like. It may make them suspicious, not just of the doctors and nurses, but also of the families, and they will feel the pressure to take this way out so they don't continue to be a burden for the families, which some of them perceive that they are being. The effect on society as a whole, where we will start to see, the value of life as less than we have done traditionally. I mean, going back to the Hippocratic Oath, when we were first do no harm, through to the Declaration of Geneva, which was drawn up soon after the Second World War to reiterate what good medical ethics was all about, that's in danger of all being swept away